Skills versus capacities in the weight room. We will be discussing 4 athletes in relation to either a skill or capacity limitation in both a back squat and Romanian deadlift. Skill refers to the ability of the athlete to control a given movement in a timely and efficient manner, whereas capacity is the ability to express a given movement quality. Athlete 1, a dancer, illustrates a skill limitation. They introduced squatting into their training program, but after a few weeks developed left anteromedial knee pain. We can see here a knee dominant squatting pattern with the knee moving forward over the foot, and the knee flexion initiates the descent. We can see reduced heel contact, especially through the left foot with overpronation, and a valgus through the left knee, which is very evident within the front on video. The thighs don't quite get to parallel, but there is good lumbopelvic control. The athlete is looking down, which is not optimal for maintaining a good spine and hip position. So assessment of joint mobility, dissociation control and gluteal strength was normal. So we looked at seeing if we could alter the pattern and timing of the movement to get a more hip dominant squat. So we changed the environment, unloaded the squat to learn that new hip dominant strategy and find their balance point. We created a greater hip moment arm, allowing the dancer to squat back further and avoid the need to take up all of the ankle dorsiflexion, which then led to the pronation and loading the knee. We used mini bands to cue the external rotators, visual cues such as squatting back to a chair using a mirror, and auditory such as sit back through your hips or sit into your heels. They then improved their skill, where they were able to squat deeper, the thighs breaking parallel and the heels now staying in contact with the ground. And this more hip dominant strategy alleviated any knee pain. There was a slightly more vertical shank and a small reduction in the trunk forward lean. But actually this appears justified to keep the centre of mass aligned over the base of support and allow them to stay balanced. So in summary, the dancer had the given capacities to perform the back squat, but needed to develop the skill by utilising a hip dominant movement pattern, which alleviated their knee pain. The second athlete is an equestrian athlete who shows both a skill and capacity limitation in the back squat, but capacity appears to be the initial cause, as they could not express the movement due to a joint mobility problem. Again, we've got a knee dominant movement pattern, with the athlete initiating with knee flexion. But we can see as that knee flexion range gets taken up, they try to externally rotate the hip and then dorsiflex the ankle, but that then compensates in the lumbopelvic area. We see a left lateral deviation of the trunk in relation to the base of support, shift of the pelvis to the left, coupled with right lumbopelvic rotation, which will also manifest itself as left spinal lateral flexion. The bar position is also an indicator where you can see it is rotated towards the right, so following the line of the torso. So we analysed this in a different environment using a pole squat. So this counterweight will take away the need for the tibia to translate over a fixed foot, so we could assess hip movement better. You can see they can squat deeper, but actually when you look at it from the back, that's all due to compensation in the lumbopelvic area. You can see in that left hip the lack of external rotation where you can barely see the thigh. You can see the shift to the left, the lumbopelvic rotation to the right. So lumbar spine range of movement and hip range of movement was assessed to look at the potential cause for this dysfunction, and that left hip showed significant loss of passive range. And the right hip and also spine needs consideration within this movement pattern, because actually this asymmetrical loading is not going to be optimal for those areas and could lead to further injury. So here is the passive range where you can see internal rotation is barely a few degrees, external, true external about 30, and actual true flexion started to reach a bony block at about 80 to 85 degrees and pain. So this back squat for this athlete, actually trying to achieve depths anywhere near parallel would not be appropriate. potentially using a quarter squat in training, or looking to get the adaptations from other exercises. So here we've demonstrated a capacity problem due to immobility of the left hip. A pole squat and passive testing was used to support the reasoning process. And the capacity is the most likely reason for the skill limitations seen, reinforcing that close relationship of skills versus capacities. Our next athlete is a dancer who shows a skill limitation within an RDL. So we can see as they go down, the bar goes a long way, not stopping just below the knees. But we see that hinge of the thoracolumbar area as they go down. Their line of sight and head position, also looking down, can give that away. But when the lines are on, we can really see that hinge through that thoracolumbar area, with almost the shoulders going lower than the hips. The line of sight wouldn't help because that's going to encourage the shoulders to drop a little bit more. And also the knee angle could be slightly less, of just about 15 to 20 degrees, whereas actually it was 38 degrees. So we went on to see if the skill could be improved, and we started looking at hip and spinal dissociation control. So we started on hands and knees to give some proprioceptive feedback through the upper body. We cued breathing out to engage the abdominals and used a pole at times down the spine to give them some kinesthetic and visual feedback by using a mirror as well. We considered standing and used auditory cues as well of pushing the hips back, and standing where that green line is, sometimes putting that as a wall and getting them to push their hips back into the wall when they were stood about a foot away. Lying down through the spine, we've now eliminated that hinge at the thoracolumbar area. We've got a good flexion angle in the knee, and the athlete is pushing those hips back. So when loaded up again, she manages to carry over this new skill into the movement, controlling the lumbar spine. We've kept the shoulders a little higher, and the bar isn't now going so low. We might need to see a little bit more knee flexion than this. But again, the main thing is that spine and hinge is much better controlled. So we quickly retrained this movement pattern, reinforcing that it was a motor control skill limitation rather than capacity. And with appropriate progressions from unloaded to loaded dissociation patterns, coaching the dancer to control their movement fault, the skill could then be executed in a more controlled and timely manner, as seen in the screenshot on the right, with that much better control of the thoracolumbar area and the bar not going so low. And our final athlete was looking at the Romanian deadlift, but with a capacity limitation. Here we had a rugby player post-spinal surgery. You'll see as they descend, you can see the thoracic and upper lumbar spine flexing, along with some increased mid-cervical spine extension. This movement is not ideal as it will result in higher shear forces to the spine, which could predispose to injury, but also hamper their rehabilitation coming back from their injury. So hip joint and spine mobility was assessed, which appeared within normal limits, a straight leg raise of 70 degrees bilateral, and they had good hamstring length. So we then went on to look at the capacity of the hip extensors, so primarily glute max and the hamstrings, which appeared good. But actually, when looking at the strength endurance capacity of the spinal extensors in terms of the erector spinae, this was below optimal. And you can see when using a lighter weight, the athlete was actually able to control that thoracic upper lumbar flexion, but it was with that higher load that they struggled to do that, again implying more of a capacity limitation. So exercises assessing and training the isometric capacity of the spinal extensors would be a recommendation before introducing load in various positions and combining this with hip dissociation movement patterns, similar to what we saw in the previous video with the sitting and standing hip hinge exercises. And we can see in these screenshots how with the lighter load, we've got better control of that thoracolumbar area. But as soon as we have that heavier load, we can see that the spinal extensors aren't able to control it as well, and the athlete goes into some flexion of the thoracic upper lumbar. This vlog has brought to life how both skills and capacities can interact in executing optimal movement, and they both need consideration when assessing and coaching